Here's my phone, sorry. Thanks. There we go.
Come and I'll sit here, I don't mind. Come and sit.
Thank you.
I've just been told, just before I came in, that the session after me has been cancelled, which is not good for them, but it means that, as well as a coffee break, I've got more time to take my time, rather than rush to the 30-minute talk, although there is a lot to cover. Okay, so we're going to make a start. My name is Phil Longwell, and this is not one of those talks that has been sponsored. I haven't got a book to plug, okay, and I'm not selling anything. Although I do have something that I want to promote, and it's not about me, but I do need to start with some personalisation. Poor mental health has affected a lot of my adult life, and especially my career as an English language teacher. I've counted that on 12 separate occasions I've left a job early, not completed a contract, or been successful in an interview and then not started due to a lack of confidence. I've had long periods of depression, I've suffered from anxiety and many panic attacks. I've even spent a week inside a secure unit, you know, the kind of place where you get sectioned. I've also spent 2 IATEFL conferences, one in Liverpool and one in Harrogate, suffering from acute anxiety, including not being able to leave my hotel room for the whole day. Last February, I did an interview for Time to Talk Day in which I went public about my own mental health struggles. It got an amazing response, and the seed for this talk was sown. A year ago, I was inspired by Sarah Mercer's plenary in Glasgow. It was on teacher psychology and well-being. I later met her, and she gave me advice as I took on some original research into this area. And that is what I want to focus on today. Firstly, I'd like to share a quotation, and I'll give you a chance to read it. Hopefully you can see it. Okay. This comes from a book called The Elephant in the Staff Room. It was written by a religious studies teacher in a sixth form college in the UK. The title caught my eye, and the subtitle goes even further: How to Reduce Stress and Improve Teacher Wellbeing. Now, although the author wrote this with the background of state education in this country, the issues that it raises and the great advice it offers can be transposed, I believe, to the English language teaching profession. Now, when I wrote the abstract for my talk last July, I didn't have much idea of the content and how the talk was going to pan out. So apologies if I deviate slightly from the abstract today. I was going to discuss existing research, but to be honest, I didn't find much. Not academic research, anyway. There was a national health survey from the Education Support Partnership and YouGov, which looked at the mental health and well-being of 1,200 state sector professionals in the UK. But as you know, we are an international bunch and not limited by country or even the languages that we teach. I found one piece of research called The Effect of Perfectionism on Burnout and Anxiety amongst 256 Iranian teachers of English. A relevant topic, but not quite a specific study group, I think. More recently, however, has come this book. This has just been published only this year, and it's a substantial collection of academic research papers put together by Sarah Mercer, who I just mentioned, and Achilles Kostoulis. As I say, it's called Language Teacher Psychology. It's by Multilingual Matters, and you can purchase it in the exhibition. Now, I did not have any of these pieces of research, only apart from the middle one. I didn't have this book or this piece of research on the left when I came to do my own research. But what I did have access to comes next. Something a little bit less academic and a lot more personal. I began to make notes of every blog post written on this topic. I remember seeing one in 2015 by Laura Patsko, who's talking right now somewhere else. And this was about Time to Talk Day. And I also saw a post about a project in Barcelona called the Mental Health Friendly Initiative. Following my own interview for Time to Talk Day last February, Sandy Millin, who unfortunately can't make it today, posted some useful links on mental health and ELT, quickly followed by Ellie Setterfield's wonderful post called The A to Z of Self-Care for Teachers. Now, there were quite a lot of posts published last year, so there seems to be a growing trend to write about this topic. And these are just a few examples. One is by Rosalie Serra, about burnout, and she's in the front row today. One was about Lizzie Pinard, talking about mental health. One is by Claire Maz, who I literally met 5 minutes ago for the first time. And one by Kieran O'Driscoll of ELT Advocacy Ireland. Sandy keeps updating her list, and I produced my own list of useful links at the end of last year, and I'll share those with you at the end of the talk. Moving on to my own research, well, this was carried out in December of last year. Having devised a set of questions, I asked a group of 5 people to be my pilot group. They road tested the questions and completed the survey and then offered me feedback. I followed the British Association of Applied Linguistics recommendations for good practice. I had to reassure all my informants that they could remain anonymous because of the sensitive nature of the answers and who had access to it. In fact, I'm the only person who has access to it, and I still do. The 14 questions were mostly open-ended and had no limit on how much the informants could write. I published the request on the 1st of December last year, and it was widely shared. I was hoping to get 100 responses, maybe 150 responses. I got 156 responses in the first 24 hours. I got another 100 in the next 24 hours. In the end, I got so overwhelmed, but in a good way, by the response that I had to close the survey after 3 weeks. I had 501 individual responses from around the world. When I copied and pasted the answers into a Word document, it ran to 178 pages and over 66,000 words. Very quickly, the only 2 questions on the survey were closed questions. These were the only closed questions. Everything was open-ended. The vast majority of the people who responded were teachers. You may not be able to see this, but 426 people were teachers. People weren't limited by one choice. They could choose a number of different things. So 426 people said they were currently teachers. 159 said they were teacher trainers. 116 freelancers. But there's obviously going to be a combination of more. Obviously, it's more than 500 because people choose more than one item. Now, the second question in the survey simply asked, how long have they been in the profession? And as you can see, and you may not be able to see at the back, there's quite a wide range of experience. Over 57% stated that they've been in the profession more than 11 years. For the remaining questions, informants were allowed to leave answers blank, but we were encouraged to write not applicable or similar. What follows is a brief look at some of the questions in the survey, and I have written an extensive summary blog post which I've just published in the last half an hour, and again I'll share that link at the end. So moving on to some of the details of the survey. I wondered how diagnosed and undiagnosed conditions are currently dealt with in the workplace. Firstly, I asked whether informants had had or have ever had a diagnosed condition. By diagnosed, I mean that a doctor or a consultant or some other medical professional has made a decision that the person has that condition. 325% out of 490 said they had no diagnosed condition. 93 said that they had depression or some variation of depression. 67 stated that they'd been diagnosed with some kind of anxiety. This includes generalised anxiety disorder, which is something that I was diagnosed with. And 8 said post-traumatic stress disorder, 7 talked about panic attacks or panic disorder, 6 said attention deficiency, 4 said burnout, 4 said suicidal ideation, which, if you don't know, means the kind of preoccupation of thoughts about ending your own life and how to go about it. A couple said dystony, which I had to look up, and I worked out it was something called dysthemia, which is kind of both bipolar or mood disorder, which is on the image there. Now, I must point out that many informants had a combination or multiple diagnoses. Some were temporary, others more permanent, and many would have been medicated for. The survey also looked at undiagnosed conditions. I asked if informants feel or felt that they suffer from something that's undiagnosed, and they were invited to explain their answer. 70 less people than the previous question answered this one, probably because they thought that, well, I've told you about my diagnosed condition, I don't need to tell you about something that's not been diagnosed. It's harder to categorise undiagnosed conditions, especially when people were asked to self-describe. Some of the symptoms were elaborated upon in the next question that follows. Stress now features here, and this is common. Again, like burnout, not an actual diagnosis, although people can be off sick with exhaustion. Stress is felt and known without sufferers needing a medical professional to tell them. Some stress, and indeed a certain level of anxiety, can be okay for some people. In fact, some people thrive on it. But when it becomes too much, that's when it becomes a problem and starts affecting work and your social life. A lot of people described physical symptoms, such as a knotted stomach, muscle cramps, migraines. Some mentioned substance abuse, substance dependency, and addiction, but not in significant numbers. A follow-up question asked whether a mental health issue in the workplace had affected attendance or performance. Although everyone responded, 301 simply said no. A further 36 simply said yes, without elaborating. It's difficult to summarise approximately 160 responses to this question who did explain what had happened, individual stories in specific situations, and often quite personal. It made it very hard to generalise. But these stories included workplace anxiety, panic attacks, severe depression, feelings of burnout, insomnia, being hospitalised, and resigning. Here is one example quotation. I'll let you read it. Another person wrote, "It didn't affect attendance, but I don't understand what you mean by in the workplace. If you have suffered from depression, it's 24 hours a day, so I wouldn't classify it as in the workplace. It's difficult to say whether my depression or my depressive episodes affected my performance. I couldn't simplify it in those management speak terms. I would say it affected my ability to feel things fully and to live a happy life. My performance wasn't at the top of my list of concerns." What was more relevant was the question of whether informants felt supported in the workplace and in what ways. Should be the next slide. Yeah. Several examples of this were given. Had about 200 responses. This included someone who stated that they had received tremendous support and were able to see a staff counsellor. They also commented at length about there being so little information in the ELT industry and wanted to carry out their own research into teacher anxiety. However, many of the responses were negative here. A lack of support. Many did not fully explain what was wrong or how they were suffering for fear of reprisals in many cases. Being given less responsibility at work can be a solution for some. But being given a lighter workload or treated with kid gloves can have an adverse effect on somebody that is suffering. Again, here is one example, and I'll let you read it. Sorry if you can't see that quite clearly at the back. I will be sharing the slides at the end. Now another question says, as an employee, would you feel comfortable disclosing a mental health condition up front or in an interview? I counted 73. Sorry, I've got the wrong one. Apologies. Lost the paper. There was about 280 people who said no to this. You know, would you disclose it up front or in an interview? 280 people out of 486 said no. Another 120 said not really or never. Overwhelmingly, the informants thought that this was a bad idea. Most commonly, the stigma, the perception of disclosure, fear of not being hired, cultural issues like you get in Korea or Japan, and not getting the required support. Here's one response from the survey. Businesses need reliable teachers, and if there aren't the management skills or training to deal with issues like bipolar, then some people would rather not hire you. Now, I've done this myself a couple of times, been up front, disclose something to a new employer. The first time I did it, the response was, well, if it doesn't affect your performance, then that's fine. More recently, I disclosed it and had to fill out an occupational health questionnaire, which promptly got filed at Human Resources. Them again. Now, not everyone said no. A few people said yes. In fact, 73 said yes before giving their reasons. A minority of informants were keen to express the importance of a condition being out in the open. A few wanted to receive understanding or possible support if they felt it might be there. Many directly wanted to challenge the established stigma and the prejudices faced. Again, here is just one example from the survey. Okay, so somebody just wanted it to be out there, wanted to establish that they were a good fit. Now, appropriate support is key here, and I'm a keen advocate for this thing to become normalised so that a disclosure will not prejudice you against getting hired. In some countries it's illegal anyway. But in others there's still a long way to go before being normalised to that degree. Now there are more reasons for why both people would or wouldn't disclose this up front on a blog post which I published today. And again I'll share it at the end. I'd like to share the next question with you, and I'd like to think yourselves about the question. I'll read it out just in case the people at the back can't actually read it. What kinds of factors do you think could be a cause of stress for language teachers? This could be your own or a college experiences. Just give you a minute just to think about that. Okay, I'll stop you there. Anyone want to give me any suggestions? Short answers?
Parents.
Parents. Parents. Mum and dad. Okay.
School manager.
School manager.
I just think in general they have such pressure, expectations, demands from all fronts, like everybody that they interact with,
Okay.
whether it's a coordinator, a director, parents, students, and then
So a number of...
And a number of people, and a lot of times interaction can have quite a negative effect on them. Like rarely does a director call a teacher to the office to say, "You're doing a great job."
Okay. At the back?
Several deadlines a day if you're lesson planning.
Deadlines, okay. Yes, Danny?
0 hours contract.
0 hours contract.
Need for reliability.
Yeah. Okay, I'll have to move on. Sorry, I apologise. I'll have to move on because of time. Now, this question resulted in the biggest response of the whole survey in terms of the most words written. I received over 13,000 words just on this question alone. Many wrote life stories and long lists of reasons. Here's a perfectionism. Anyone get this? No people that get this? Vera? Workload? Some of you said, workload. Job insecurity. So that would include 0 hours contracts. Now, these are in no particular order. There are no particular order of some of the factors, and there are only some of the factors raised. Here's some more. Parents. You said it. Did you do my survey? Unrealistic expectations, that thing of like, you've got to show progress. Go from IELTS band 5.5 to IELTS band 6.6 in the space of a month. Impostor syndrome, do you know this one? Impostor syndrome?
Oh, yeah.
That feeling that you're a fraud, like I feel now, I shouldn't be here, this is my first ever talk anywhere. So maybe not today. Harassment and bullying. This came up a lot, harassment and bullying as a cause for stress. Now, something that comes from the book that I mentioned earlier by Chris Eyre is the issue of the perception of stress. And Sarah Mercer recently drew attention to this in a webinar. I'd just like to share this quote. So stress occurring where there's a mismatch between the perceived pressures of the work situation and the individual's ability to cope with it. Here's a quote, here's a quotation from the survey. Here's another. DOS, anybody? Directors. Any directors of studies in the house?
Former.
Now, with the next question, I had a lower response here because this was targeted at employers and managers. In some ways, the question is quite narrow because it asked about how confident did they feel at recognising symptoms. 181 responses to this question, many stating in their own words how confident they felt. Some said very confident, some said fairly confident, some said somewhat confident, and others described it in their own ways. Where there is a lack of confidence, it can be traced back to the question about disclosure up front in a job interview. Employers hold back information. They're often good at hiding their symptoms. Let's remember that signs of mental distress are not always obvious and can be covered up in a way that more physical symptoms can't. A lot of anxiety comes from suppressing feelings and not being able to share internal concerns in an appropriate way, or there are external factors which the person doesn't want to raise, making it difficult for these problems to be addressed. Personally, I had a lot of panic attacks coming from not being able to verbalise some of these suppressed or overwhelming feelings. Here's somebody that said they were confident. Feel she was good at recognising poor mental health from personal experience. And here's somebody that said they were not confident. Again, training is mentioned, or a lack of it. Now, the next two questions are related, and they overlap in some respects. They relate to how individuals manage their symptoms. The first one asked about tactics and coping mechanisms. Now, I say the difference between tactics are that these are generally positive methods and steps to take and to deal with or alleviate the situation, and coping mechanisms are more generally ways of getting through a situation and not necessarily the healthy option. Drinking and smoking might be examples, or relying heavily on taking medication, like diazepam. Here's some of the examples. Some of the things that people said. This is a very, very brief list. CBT? Anyone CBT? Thank you very much. Nice interactive crowd. Mindfulness. Anyone talked about mindfulness recently? Anyone come from Rachel's session on mindfulness? Good. I think they deliberately did it so that it could come to focus. Medication, commonly taken, although it can be difficult when in another country where you don't speak the language. And meditation, which is positively encouraged in some countries, some cultures. Here's the answer from one person. So walking away from situations, but then coming back, talking to yourself, not in a mad way, just in a reassuring kind of way. You used to get locked up for it. Breaking things down, making things more manageable, focusing on the positives. Another question said, in what ways do you look after your own mental well-being as a teacher? Now, there's only time to briefly show some of the responses. I mean, some sessions at IATEFL deal with coping mechanism, your well-being in more ways than one. And Rachel's is an example of that also. Here's a list of some of the responses, just keywords come out of the survey. Again, if you can't see it, physical exercise, top of the list. Physical exercise. 64 different people mentioned physical exercise. Meditation, 25. Sleep. I said insomnia earlier, getting enough sleep is important. Having a life outside of work. Somebody said hip-hop dancing. That was just one person. And 2 people mentioned their faith or their belief. Now, here's one person's response to this. It might be a bit short, it might be a bit hard to see, so I'll just say they're talking about going to dance classes, the cinema once a week, planning and cooking food for yourself, eating healthily, routines, good night's sleep. Mental and physical health so intermingled. This is so true. Physical affects mental, mental affects physical. If ELT professionals are to improve their own mental health, it is critical to know that they are not alone and can talk about this. There is so much to learn from others, and again, I'll share a list of blog posts which try to do that. Before I conclude, I would like to show you this question. It's not just about the individual. It's about what can employers and institutions within ELT do to support the mental health or well-being of its employees. You probably have your own thoughts on this one. Again, for the lack of time and brevity, I'm not going to do a straw poll of everyone's views, just to say that this can be linked to the external factors given as a cause of stress in the earlier question. This also received a large response, over 10,000 words written. I've made a word cloud, and the word cloud, again, it's on the blog, and it's just all the key words thrown together. Training came up top of the list. Training or the lack of training. So providing training. In fact, another question separately, it's in small print, but I'm not going to go into details, but another question specifically asked, have you ever received training in how to support teachers' mental health? Counselling and awareness raising also featured high. Pay, working conditions again, and job security. Recognising signs came up in an earlier question, and some managers felt confident, but it's not always about managers being able to detect signs which are being kept hidden by employees. It's about creating an atmosphere where these issues can be raised. management should be open to receiving feedback about those factors which cause stress and not to dismiss or to minimise concerns. Now, some teachers, like myself, go into English language teaching with pre-existing conditions, even if they're undiagnosed. Some of them are exacerbated, however, by the working conditions that they face. Okay, we're nearly there. Just want to show you two final quotes which are at polar opposites in the views that they expressed. Hope you'll be able to read it. There's loads more of these views on the blog, but these are kind of opposite views. You can't read the red writing, it's a bit faint. One says individual and the other one says structural. Firstly, the individual. Can you see that? I don't think you can see that. Can you see that over there? Yeah. Stop worrying about all this. This is all rubbish. Just get on with it. This is nothing to do with ELT. Silly. It's redundant. Here's another view. I don't know if anyone would agree with that view. Again, it's some people are advocating for workers' groups, supporting teachers from discrimination, recognising rights, advocating for them. And another person, the same person who wrote this and said, I'll read it out. I'm worried that too much of the focus is on the psychology and well-being of the teachers, and this detracts from the broader systemic issues that cause these issues in the first place. As Kieran O'Driscoll, who I mentioned earlier, wrote in their blog post just last December, the problems with low levels of pay, poor conditions and insecurity of tenure of English language teachers are widespread in our industry. Fortunately, moves are now afoot thanks to things like the ELT advocacy, Unite the Union and other bodies to attempt to begin to resolving these endemic problems, so that it is to be hoped that the role of the English language teacher, well in Ireland at least, will enjoy much greater security in the future. Okay, my conclusion. With such a tremendous response to this survey, the topic clearly hit a nerve with many people in the profession. It managed to draw out some qualitative responses from many who had suffered from poor mental health in the past and many who still do. It received contributions from those with no direct experience but were eager to know more. One person stated clearly that mental health is not something that should be discussed, it's something that should be treated. Now,
God.
I agree with the second bit, whether it's medication or counselling or therapy, but not talking about it is not the way forward. I'm an advocate for time to change, and I've done work and done volunteering work for them, and they seek to challenge the stigma and end the discrimination around mental health issues. No one should be alone when it comes to facing a mental health issue. The discussion must be open and continue until we reach the point of it being normalised. Now, the survey did not deal with the question of whether teachers go into the profession with existing conditions, which are then exacerbated by the conditions that they face at work. So it would be unwise for me to draw any conclusions that the profession itself is the direct cause of poor mental health. Nevertheless, some of the working conditions and experiences do not help. A lot of anecdotal evidence from the survey showed that those who do suffer had learnt how to cope or to walk away. Many had clearly developed ways of looking after their well-being, while others sought to blame systemic or organisational issues outside of their immediate control. Many felt for years that they were the problem, not the external context of their employment. Now, whilst we can sympathise with institutions needing a reliable workforce, the constant strive to be competitive and the business demands of many ELT situations can lead to teachers being undervalued, mere commodities in the process. We are people, not disposable human resources. As one person stated, and I'll finish with this, until teachers are treated as people and not commodities, then the whole mental health issue in ELT is not going to change. Thank you very much. Feel free to come up and take a scan of this, or as I say, I've just published the results of my survey today. It's on my blog. The slides are there. That takes you directly to the blog. I'll just quickly show you my references, and then I'll go back to the previous slide. Please do come up and have a chat and have a